welcome to the January 3rd, 2021, 2022, there we go, correction already, Grafton Board of Health meeting. As a preliminary matter, I'm Dan Finn, Vice Chair of the Grafton Board of Health, and please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Austin Magnet.
Austin Magnet is here.
Okay, and Bill Muller.
Bill Muller is here.
Jennifer Maynard.
Jennifer Maynard present.
Okay, and Karen is not able to make it this evening. And then staff and anticipated speakers on the agenda, when I call your name, please respond in the affirmative. Nancy Connors.
Nancy Connors here.
Okay. So I'd like to open the meeting if I could please get a motion to that effect.
This is Bill Muller. I move that we open the meeting of the Grafton Board of Health.
And a second.
This is Austin Magnet. I will second that motion to open the meeting.
Great. And all in favor? Bill Muller,
Aye.
Austin Magnet,
Austin Magnet, aye.
Jennifer Maynard,
Jennifer Maynard, aye.
and Dan Finn, aye. So let's see, good evening. This meeting of the Grafton Board of Health is being conducted remotely, consistent with the act extending certain COVID-19 measures adopted during the state of emergency. And it includes an extension until April 1st, 2022 of the remote meeting provisions from the executive order of the governor of Massachusetts. In order to mitigate the transmission of COVID-19 virus, the act extends the requirement of the open meeting law to have all meetings in publicly accessible physical location. Further, all members of the public bodies are allowed to participate remotely. The order, which you can find posted on town's website at www.graftonmass.gov, allows public bodies to meet entirely remotely as long as reasonable public access is afforded to the public and can follow along with deliberations in the meeting. Okay, for this meeting, the Grafton Board of Health is convening by video conference via Zoom as posted on the town's website and identifying the public may join. Let's see. All supporting materials that have been provided to the members are available on the town's website. And before we turn to the meeting of the agenda, let me go over a couple of ground rules. I'll introduce speakers on the agenda for a topic, and after they conclude their remarks, I'll invite board members to provide and comment questions or motions. Please identify yourself by name when speaking. Just remember to mute your phone or computer when you're not speaking, and please remember to speak clearly and in a way that generates accurate minutes. Okay, and if members wish to engage with other members, please do so through myself. And finally, any votes on any motions made during this meeting will be conducted by roll call. So on the agenda, we basically have mitigating COVID-19 and the measures. And I just want to mention a couple of recent statistics. Over the past 3 days in Massachusetts, there were over 31,000 positive cases, a 29% positivity rate, and 31 people passed away. And the hospitalizations are up to 2,221, which is a 14% increase over last week. Worcester had a 33% increase in positive tests as of last Thursday. And last week, Grafton had 145 cases, which is certainly up from previous weeks. Before we get started, we're going to talk about possibly issuing an executive order or an emergency measure for restrictions or regulations, or two possible ones. I just want to mention I have had some feedback from some members of the community, some negative feedback and concern that In the case of businesses, that it's so-called mandate, I know nobody likes the word mandate, or either one of these would cause stress and financial stress on businesses, especially restaurants. And personally, I can sympathize with that, having been in business myself for 22 years or so, and it is a concern. But how does anyone else feel about those concerns?
This is Austin. I can, I guess, agree with their concerns of, people potentially losing business from people either not going out or not being able to offer their full entertainment or whatever they offer to people who now have to wear masks. They can't stand 6 feet away. Or, I guess I see this mandate as a Board of Health thing. If it adversely affects a business, or at least in their eyes, what sort of repercussions could come back on us? Even, we're not really financially capable of supporting businesses if they go under. And if they need to have patrons with masks on, are they going to be responsible for masking their patrons? Just a few things to talk about.
Sure. Anybody else?
Oh, go ahead, Bill. Go ahead.
Yeah, Bill, sure.
Yeah, I do think that we've made a good faith effort to avoid resorting to some of these measures, and certainly have been deferential to the businesses that at least potentially would be adversely affected by some of this. I think, though, given some of those statistics that you're alluding to, there's no doubt that this new variant is an extremely contagious variant, and one where some of the mitigation efforts are really overdue at this point. Even though I understand the legitimacy of the concerns that they're raising, I think we're past the point where we can defer consideration of these things any longer.
And I know we actually started considering these types of restrictions back in September, and we all agreed that at that time the trend was going down, and that we would reconsider as the trend, if the trend in fact escalated. And Jen, did you have anything to say?
Yeah, I guess my only sort of clarification is there concern that requiring folks to wear a mask may deter them from coming into the businesses? Is that what the primary concern is?
Yeah, that's what I understood from a couple of people that I spoke with, and I think a couple reached out to Evan as well.
I guess I would offer, as part of our decision-making process, one of the things that we did talk about is our own personal observations in the community of mask wearing practices by constituents in town at some of the local businesses. So I think that was something that we've also observed, that there are folks that do actually wear them quite often, and there are establishments that employees are wearing them pretty consistently. So that was something I think we did talk about. I think the other thing, in addition to what Dr. Mueller said, is that we also have to consider that if we have outbreaks at certain places, we have some limitations to the amount of information we have until perhaps it's too late to offer any mitigation efforts or reach out to state partners for additional assistance, with kind of limiting, not having knowledge right at the Board of Health that, we have 3 cases, or, this place is kind of being a hotspot, if you will. So, we're a little bit operating blind right now. And I think that is also, something the board has to consider. While there are always risks for businesses, there's also, a risk to our obligation to all of the constituents
Right.
often.
Yeah, that's, part of our charge as a Board of Health. I also just heard, as an aside, not really, but that the Omicron variant is so contagious that maybe the 6-foot rule and the 15-minute idea rule with the Delta is not enough in either case. And I don't know, I guess Bill, if you don't mind reading one of the emergency regulation orders.
Okay. We can start with the emergency regulation requiring face coverings in all indoor private common spaces in the workplace and indoor private spaces open to the public in the town of Grafton. Whereas the town of Grafton has had 2,135 positive cases of COVID-19 as of January 3rd, 2022. And whereas the Omicron variant is more contagious than the original COVID-19 virus and has been proven to infect fully vaccinated individuals, predominantly asymptomatically, which results in vaccinated individuals being silent spreaders, greatly contributing to the increase in COVID-19 cases. And whereas in November, Grafton positive cases were twice the number of positive cases in October. And in December, Grafton positive cases were more than double the number of positive cases in November. And whereas as of December 28th, 2021, Grafton has an average daily infection rate of 77.4 per 100,000. And whereas local hospitals are at maximum capacity, there are currently no regional medical hospital beds available, and the one pediatric ICU in the city of Worcester is full. And whereas indoor meetings create an environment for the highly transmissible Omicron variant to be spread, and whereas wearing a face covering reduces the emission of virus-laden droplets, source control, and reduces the inhalation of virus-laden droplets, filtration for the wearer protection, which has proven to be highly effective to prevent the spread of COVID-19 virus and provide protection for vaccinated individuals as well as for unvaccinated individuals. Whereas the Centers for Disease Control, CDC, and the Massachusetts Department of Public Health, MDPH, strongly recommend wearing masks indoors. Now therefore, pursuant to Massachusetts General Laws, Chapter 111, Section 31, 104, 122, and all other authorizing statutes and regulations, the Board of Health of the town of Grafton adopts the following as an emergency public health regulation effective January 5th, 2022. Effective January 5th, 2022, all individuals age 5 and older shall wear a face covering in all indoor private common spaces in the workplace and indoor private spaces open to the public, including but not limited to the premises of a business, club, place of assembly, or other place that's open to members of the public, including but not limited to retail establishments, restaurants, bars, performance venues, social clubs, houses of worship, personal care and fitness establishments, and event spaces, except when an individual is alone in a workspace, or alone in a room in a workplace with a closed door or socially distanced from other individuals. A face covering for the purpose of this regulation may include, but is not limited to, cloth, masks, scarves, bandanas, and other coverings, so long as the person's nose and mouth are covered. Following individuals are exempt from face covering requirement. Individuals for whom a face covering creates a health risk or is not safe because of any of the following conditions or circumstances. The face covering affects the individual's ability to breathe safely. The individual has a mental health or other medical diagnosis that produces produces a written note from a physician that advises against the individual wearing a face covering. The individual depends on supplemental oxygen to breathe. Face coverings may be removed indoors when an individual is actively eating or drinking. The face covering requirement shall not apply to performers while performing, provided they are at least 6 feet away from any customers. All entry doors of businesses open to the public must post notice advising customers that face masks must be worn upon entering the establishment. If a customer refuses to wear a face covering, absent a qualifying exemption, a business may refuse admittance. Supplemental guidance may be issued by the medical director or director of public health as necessary to clarify and implement this regulation. This regulation shall remain in effect until rescinded by the Grafton Board of Health.
Thank you. On that last point, I think if we do issue an order on this or another order, we would continue to look at the trends, and if we decide to do this, it would be as soon as next week, but probably more like a month or two, I'm guessing, if the trends reverse in direction, is my opinion, that we would keep an eye on it in that regard. Nancy, is that you?
Excuse me?
Yep. Did you want to speak?
No?
Okay.
Karen Clark is on in
Oh.
case we need her.
Okay. Let's see if I can find her.
She can't, she's not, no.
Oh.
We are conversing via email.
Oh, okay, gotcha. Okay. Does anybody want to make a motion on that particular possible order?
This is Bill Muller. I move that we adopt the emergency regulation notice as presented.
And just could you read what it's actually called, the title of it there?
It's called the emergency regulation requiring face coverings in all indoor private common spaces in the workplace and indoor private spaces open to the public in the town of Grafton.
Is there a second?
Second, Jen Manders.
And how about a vote by roll call? Vote. Bill Muller,
Bill Muller, aye.
Austin Magnet.
I was just gonna say, it looks like we have a few chats. Somebody wanted to hear something again.
Oh, okay. Yeah, we can discuss, sure, before we take an official vote. Right. There's one chat is, are these mandates going to cause hardship for businesses? Another one, will we be sending businesses to surrounding towns?
It says which mandate is that we're considering is going to cause a hardship. It sounds like from the feedback that you said, Dan, is the masking in particular is what local
Right.
businesses have.
Right.
Yeah, I think the mask mandate, yeah.
And there was a question about requiring remote participation. That is not something that we're talking about today. We should probably note for folks that may not have heard prior conversations about these mitigation efforts, these are actually some mitigation efforts that have been adopted by the city of Worcester and many surrounding communities. Not all, but several in the coalition have actually adopted these. What, back in September, as you said, Dan, as we first
Right.
talking about it?
October, beginning of October, I believe, and then, right, I believe, not just Shrewsbury, but, well, I shouldn't speak out of turn, but I know a couple other towns that I was shopping in, they had signs up as well. I don't know, I just, as far as sending people, is going to another town, I think it might actually secure some business, repeat business. I know a number of people that like to see that the businesses are treating their clientele and their employees, safely, and it might encourage them to come back, frankly. So there's always going to be some follow-up.
You're right. This is Austin. Some people might even be more comfortable going out knowing that there's a mask mandate.
Yeah, another commenter did say they'd like to hear a little bit more about the exceptions to masking, and that they didn't want us to be the only town without a mandate. Like, we wouldn't be the only town, but there have been several that are in the coalition that have adopted.
Okay. Nancy, can you speak up about what Shrewsbury has done?
Shrewsbury followed Worcester, and then West Boylston followed Shrewsbury with these regulations that you are discussing right now.
Okay. And I honestly should have checked it at Westboro and Northborough, where I happened to be cruising through on business. And I did see some signs that looked like mandate signs. So again, you can't quote me on that, I'm afraid. But I think Millbury is actually doing this evening. Someone mentioned, so I think that's good to know. They were hesitant as well. And I believe Sutton is considering it too. Bill?
Dan, I do think one legitimate concern that has been raised in other venues is the idea of enforcement.
Right.
If somebody enters your business and refuses to wear a mask, that can lead to unpleasant interactions with customers.
Right.
Certainly, I think there's been a lot of publicity about that sort of thing happening on airplanes and things of that sort. But I am sympathetic to the position that we're putting owners of a business in a position of trying to be the enforcer of a regulation.
Yeah, I know Karen had mentioned that the Alliance folks would assist the inspectors, and they're employed by the town of Grafton.
Sure.
With going to businesses, but you would hope nothing comes to fisticuffs, and I don't think they want to tackle that either. But it just seems to me at this stage of the game and time, anything we can do to try to slow this down.
Right. I do think also it potentially means that it wasn't their unilateral decision to really enforce this. That basically it's something that we as a community decided it was in the best interest of people within our community.
Right.
So-
Unfortunately, there's not very sharp teeth in the bite, in terms of fines or
No, I know, sure.
or the police or anything like that, but sort of on the honor system, I suppose. But I think people have to realize how important this is. And to Jen's point, unofficial surveys around town by several of us a month ago, it was more than 50%, approximately 50%. I happened to check with some local proprietors of people were masking, and then it seemed to drop off somehow. So I think it has to be.
Well, I do think one of the things that's alluded to in this statement is that it's possible to be an asymptomatic carrier even if you've been fully vaccinated and boosted. And so people can inadvertently be vectors and potentially infect people who are more at risk to become more seriously symptomatic without really realizing it. I think the other point to make is there's so much home testing going on now that we're probably seeing only a fraction of the total number of people who are currently infected, particularly since you can be infected and not be symptomatic.
Right. One of the folks listening in was asking to hear just about the exceptions one more time. Do you have that handy, Bill?
I do. The following individuals are exempt from this face covering requirement. Individuals for whom a face covering creates a health risk or is not safe because of any of the following conditions or circumstances. The face covering affects the patient's or the individual's ability to breathe safely. The individual has a mental health or other medical diagnosis and produces a written note from a physician that advises against the individual wearing a face mask covering, or the individual depends on supplemental oxygen to breathe.
Okay, thanks. Okay, and anyone that wants a copy, we can publish it. Actually, it's going to be posted at the town clerk, but we can get an official copy off. And so I think we should move the question. Bill, you made a motion.
Yeah.
Jennifer, you seconded that motion. So all in favor by roll call, Bill Muller.
Bill Muller, aye.
Austin Magnet.
Austin Magnet, aye.
And Jennifer Maynard.
Aye.
Dan Finn, aye. So I declare that motion carried unanimously.
And real quick, it looks like Jennifer Paluzzi from the Grafton Common wants the wording, so she can probably post it too. It's in the Q&A. She sent her email too.
Thank you, Austin. Bill, if you could just read the wording on that particular order that we're issuing, please. Just the title.
The title of it?
Yep. Or the emergency requirements.
Yeah, the emergency regulation requiring face coverings in all indoor private common spaces in the workplace and in indoor private spaces open to the public in the town of Grafton.
Okay. And also, I believe it says in there, and I think you read it, that it would go into effect on Wednesday, the 5th.
Yes.
Because
January 5th.
We would need some time to post it and make signs available, etc.
Just to clarify, Jen Paluzzi is actually requesting that we email a full wording of the mandate to Jennifer@graftoncommon.com.
Sure, we can do that. Right after the meeting, hopefully, or first thing tomorrow morning. And the second order that we're going to discuss and vote on one way or the other has to do with employers reporting positive COVID cases. Jen, could you read that for us?
Yes, and it's a little lengthy, so bear with me. Emergency regulation requiring employers to report positive COVID-19 cases in the workplace in the town of Grafton. Whereas the state COVID-19 state of emergency ended on June 15th, 2021, which also ended the Commonwealth's mandatory reporting requirement for employers to notify the local Board of Health when the employer learned of employees testing positive for the coronavirus COVID-19. And whereas the town of Grafton has had 2,135 positive cases of COVID-19 as of January 3rd, 2022, and whereas the Omicron variant is more contagious than the original COVID-19 virus and has been proven to infect fully vaccinated individuals, predominantly asymptomatically, which results in vaccinated individuals being silent spreaders, greatly contributing to an increase in COVID-19 cases. And whereas month-over-month case counts increased by 103% from October to November and 94% from November to December, and whereas the November Grafton positive cases were twice the number of positive cases in October, and in December, Grafton positive cases more than doubled the number of positive cases in November. And whereas local hospitals are at maximum capacity, there are currently no regional medical hospital beds available, and the one pediatric ICU in the city of Worcester is full. And now therefore, pursuant to Massachusetts General Laws, Chapter 111, Section 31, 104, 122, and all other authorizing statutes and regulations, the Board of Health of the town of Grafton adopts the following emergency regulation effective January 5th, 2022. A, employers shall encourage workers who test positive for COVID-19 to disclose and inform the employer for purposes of cleaning, disinfecting, and contact tracing. B, when an employer is notified of any positive case at the workplace, the employer must immediately notify the Board of Health. C, employers are required to assist the Board of Health with contact tracing efforts, including advising likely contacts to isolate and self-quarantine. D, employers will require testing of other workers at the request of the Board of Health. E, employers shall notify workers that they may not work if they test positive for COVID-19. They should be isolated at home or are found to be a close contact of someone with COVID-19. They should be quarantined at home. F, notwithstanding the foregoing, vaccinated asymptomatic workers found to be a close contact for someone with COVID-19 may stay at work, provided face coverings are worn and they are tested 3 to 5 days after their exposure. G, employers having businesses that operate at various shifts shall designate a person in charge of each shift to oversee implementation of the requirements of this regulation. And H, this regulation shall remain in effect until rescinded by the Grafton Board of Health.
Thank you. Nancy, excuse me, this is going to cause a little more workload for you, but I believe the Alliance is going to be able to assist too. Is that correct? Or you'll be able to relay that information to them?
Which part, Dan?
As far as employers reporting, they're going to be calling your office
Right,
more frequently. So
correct.
does the Alliance have the personnel to help with that? Whether it's
The phones
contact
here in
tracing or
the-
clustering?
Not with the phones here in the office. No,
Okay,
I'll
But you-
be doing that.
but you'll get that information to them somehow.
Oh, yes.
We talked about
Okay.
the spreadsheet or something, Nancy, that you are tracking or were tracking things on for them.
I am, well, we've got many calls on reporting cases, questions on cases. Where do I go for a test? I mean, today we counted at least 75 phone calls in here.
Yep, it's a lot of work.
Yep.
But we appreciate it. A question has come up about something that we can talk about after we finish with this discussion about possibility of town boards and committees meeting remotely for a while. But that's a separate discussion we can have. But at this time, could we have a motion of whether or not to issue the order on the reporting, employers reporting?
Yes.
I just had a few questions about the.
Go ahead.
I didn't attend last week's meeting, so maybe you guys discussed all this.
Yeah.
It says that the Board of Health is requiring the employers to test people. Who would pay for those tests? Is that the Board of Health that would pay for those, or would the employer, or would the individual have to pay for that?
That's a good question. Tests are pretty hard to come by. I don't really know. I think there'd be some leniency as far as being able to acquire the tests, and perhaps the Board of Health would be able to assist with that. I think we're getting some from the Worcester Alliance, and if an employer wasn't able to acquire them, I suspect we'd be able to help out with that.
Right. So
Dan?
Yep.
Excuse me, Dan. I was told that those are for the seniors, for the homebound, people who cannot get out, seniors
Okay.
who are sick, and for the group homes.
Oh, yeah.
So unless I get direction
Right.
otherwise.
And Jen?
I will say the Commonwealth does have a website to help people find tests. And one of the resources that they do have is a free mail test for PCR, not rapid, but a free resource to get, and you get it within 24 hours. You can put in your information. They send you a kit to FedEx. The person can test and then send it out with some parameters around holidays. So there are tests available free of charge through the Commonwealth. Certainly, Dan, as you said, we could certainly see if there's any way for local boards to have access to rapid test kits for employers in town. This doesn't specify what type of test would be required. So, certainly those resources, just like they're available to any Commonwealth constituent today, would be available to businesses and their employees as well.
And that says testing of other employees, so that means that probably everybody who comes in close contact at the workplace would have to get tested.
You'd be using, the close contact, I think, not to speak for everybody else, but contact tracing typically, there's certain parameters, at least as Dan said, as of today, it's still the, 6 feet, less than 6 feet for 15 minutes or more right now is still the standard. And so if that person was in close contact, in particular without a mask, that certainly raises the stake, but that would be the standards around who needs to be tested.
Should we maybe add that wording to D? Because it just says the other workers. It doesn't really specify those within close contact or everybody else. I feel like it's a little vague.
Well, this one says employers will require testing of other workers at the request of Board of Health. Let me see.
Only if we request it in specific cases.
Yeah. Yeah, and basically that they have to help us with those contact tracing efforts. So what would typically happen is, if an employee discloses, to Bill's point earlier, if they took a test at home and they tested positive and they called and identified that to their employer, their employer could ask, who'd you sit in the break room with on this day, 2 days before, if you were not here for 2 days, who'd you last sit in the break room with? And using the sort of CDC guidelines around when people are most contagious, gathering that information from the employer so that when they call the Board of Health, the more information they have, then it can mitigate some of the sort of callbacks, and that would help identify people that need to be tested.
And what does the Board of Health do with all the positive case information? Are we doing anything that the state's not doing?
The cases that I get in here in the office, I contact the Alliance, the nurses in the Alliance that belong to part of the coalition.
Would it be easier if we just have everybody contact the Alliance and bypass the Board of Health?
No.
Okay.
Unfortunately.
Yeah. At the same time, I don't know what you folks think about the possibility of postponing this particular vote or issuing this particular, oops, sorry. Particular emergency order or until next week's meeting on the 10th. Because there are a couple of good questions there, Austin, about the availability of tests. And it's going to take the employers a little time to get on board with this, probably couldn't do it before the 4th in that regard, and maybe tighten up the language on that and possibly have
What method do we have of notifying all employers of the town that this is their new requirement? Do we have like all their emails or something?
Yeah, Nancy acquired those today, actually.
I have quite a few, Austin. I've got obviously all the food establishments. I got a lot from John Allen, Economic Development. I also received some from the Town Administrator's Office. There's the Alliance will be going out also with the regs and the signs regarding the wearing of the face shields.
Right.
Are there any sort of consequences if businesses fail to report it, or if they don't even know that they're out of compliance with reporting?
Unless it says it in the regs.
Right.
Like if their employer doesn't tell them that they tested positive, is the business responsible for not notifying?
I think those are a couple of good questions, Austin, and that maybe we ought to review this over the next week or so and tighten it up. I know town council or Jenny and reviewed these and thought they were pretty legal and all, as well as Evan has been in the loop too. But personally, I don't think it would hurt to wait a week on that particular piece and try to put something forth that's going to be a little easier to adapt for everyone. What, anybody else agree or disagree? Bill? Oh, you gotta unmute, Bill. There you go.
Now unmuted.
Right.
I do think as a practical matter, there are some mechanics of how this would actually be implemented that really need to be understood.
Right.
And since Shrewsbury and other places, Worcester and other places have been doing it, I think it would be helpful to get some perspective from how it's been operationalized in those communities.
Yeah, so I don't think we need a vote to postpone the vote, but I think we should just put this on the back burner and bring it up at next week's meeting this Monday evening.
I won't be here next for the next meeting, so just two quick points in kind of that discussion.
Yep.
Truly reported, these businesses and everybody was reporting these cases previously. So we're not really probably talking about much different except for sort of re-education around so maybe some of the questions to ask, and to Austin's point around the testing pieces. So it's not I don't think it's really good news about being so far into this pandemic, is that we do have some experience with these things. It's just how do we make sure we're not missing anything now, that it's
Right.
at the town level versus at the state level. And that said, the only other thing I would just kind of indicate is, in the space of the medical community, anytime you have one place that has 3 or more of the same infection, you have a cluster of an infection. So the whole point of these things that we're talking about are to help our community not go backwards, do the sort of minimal things that we can do to help mitigate those risks, because none of us want to go backwards. And, 3 or more cases in a restaurant that might also already be struggling with staffing is pretty significant for their staffing and their business model as well. So I
Right.
guess I would just throw that out there for consideration next week, that, we don't want to have all these huge clusters coming up and then have, DPH late in the game trying to see what they can do to help our community, where things are just kind of where they're at right now. So that's what I would offer as by way of conversation next week.
Right, thank you. And we're gonna have a firmer feel on the 5 days versus 10 days piece as well, and the restrictions and conditions of that. And so let's put that one off. And I just want to mention that I did just find out that over 100 towns, in addition to Worcester, Shrewsbury, and West Boylston, have adopted the mask regulations. And so that's good to know. So again, one of the folks in the meeting here asked about other boards, town boards, whether they should go remote for the next 4 to 6 weeks. I mean, it sounds like a good idea to me. What do you folks think? I don't think we can mandate it or whatever, but we might recommend it perhaps.
I think it would be reasonable to recommend seriously considering it.
Austin, what do you think?
Sorry, I missed that. It was kind of cutting out. Wow. What do I think
yeah.
about what?
About that we would recommend as the Board of Health that other town boards and committees meet remotely for the next month, say the next 30 days.
Yeah, we should definitely still be meeting remotely, especially with how highly transmissible this Omicron is.
Right, and it's not that inconvenient.
Yeah.
So I think
If they don't,
Exactly.
that's another reason why you have the mask mandate. If you're meeting in person, then you should be distancing yourself and wearing masks, so that, again, mitigating risk. But I agree.
so. I don't know if
Exactly.
someone doesn't mind making a motion that we recommend that the Grafton Town committees and boards meet for the next 30 days remotely. It's just a recommendation.
I'll move that we recommend that town boards meet remotely for the next 30 days.
Is there a second?
This is Austin Magnet. I will second that recommendation.
Okay, and by roll call, all those in favor, Bill Muller,
Bill Muller, aye.
Austin Magnet,
Austin Magnet, aye.
Jennifer Maynard,
Jennifer Maynard, aye.
and Dan Finn, aye. Okay. So Nancy, I guess we're gonna post another agenda by Thursday for next Monday, but we'd like to add the employer reporting requirement to that.
Right.
Thank you. Any other? Sorry about that. Leave that for a second.
Dan, I just want to make note that LAR from the Grafton News also is requesting some of that wording on the mask mandate.
Sure. I'll see that we get that off, or Nancy can obviously help us as soon as possible with that.
If you can let me know, Jen Paluzzi,
Yeah,
and what was her email? Somebody get that?
It's Jennifer@graftoncommon.com. And then tell me when you're ready for the next one.
Okay.
And then the second one is L Redmond, REDMOND 07221960@gmail.com.
That's L Redmond, right?
Mhm.
Okay. Thank you.
Any other business that folks want to discuss?
I think the final question that came up in the Q&A,
Mhm.
an attendee is inquiring if we have any insight into the positivity rate compare in those towns that have adopted a mask mandate to those that do not have.
I don't believe we do, but
Certainly the coalition could give us some information about that.
yeah. So we'll try to have that out. I'll see, we'll find out who asked that. We'll get that back, or we can have it by next meeting at least. Let me just see.
We
Yeah.
should maybe also talk about, how we just did the 30-day recommendation for remote meetings. We should maybe look at the dates on our next meeting, because our February meeting is the 7th. And so that 30 days would be rescinded before our February meeting. So we might want to kind of adjust the dates so it covers that period.
Right, looking at our next meetings we have one next week on the 10th, and then you're right, it was the 7th. And February, and the 7th of March. And today's the 3rd. Well, we could move the meeting, or we could or we could take another vote recommending 6 weeks. I don't know what if everybody thinks about either going to oh no, I see. Today's
You
the
want to
3rd.
amend the
Oh,
motion?
I see, we'd have to move it into January, so January
Dan, do you want
31st.
to amend your motion? Rescind it to discuss it next week?
We could keep it as is and just discuss it again next week and possibly do 6 weeks then.
Right, okay, that makes sense. That will keep things less complicated, so
Right,
maybe
and
we can put that
you might
on
hear from
Monday's
the other
agenda as
boards.
well.
You might hear from the other boards in that time, so that makes
That's
sense.
right. That's right. We may get some other opinions on that. Okay. If there's no other business, I think I can entertain a motion to adjourn.
Bill Muller, I move that we adjourn the meeting.
A second.
Jen Maynard, second.
And all those in favor by roll call, Bill Muller,
Bill Muller, aye.
Jen Maynard,
Aye.
Austin Magnet.
Austin Magnan, aye. And I want to say congratulations to you, Jennifer Maynard, for
Yeah,
getting married.
that's
Thank you.
exciting. It's exciting.
That's my tired voice, so sorry if you hear me a little.
Well,
Thank you.
Totally.
I appreciate that.
that's great.
You're welcome.
Congrats. And Dan Finn, aye. Okay, thank you, everyone.